Hi, I'm Laura McLaughlin, and thank you for watching the show. I'm so excited to welcome my guest, Dr. Judy Ho. She is a tenured associate professor of psychology at Pepperdine University and a triple board certified and licensed clinical and forensic psychologist. She is a two-time recipient of the National Institute of Mental Health Service Research Award, maintains a private practice in Manhattan Beach, California, and hosts an active clinical research program. Now, she might look familiar to you because she frequently appears on television as an expert psychologist and currently co-hosts CBS's Face the Truth. With all of that, she had time to author a new book entitled Stop Self Sabotage, which is out August 20th. Now, when I found out you wrote a book, I had to read it, and it is wonderful.
Thank you for reading it. I mean, it means a lot coming from you because of all of your experience. You're a clinician, so that means a lot to me.
Yeah, from a clinician. I would actually give this to my clients.
Yay!
Yeah.
Oh, that's great.
So
that's what I want.
There you go. Now, the audience should know we have known each other, I think, for almost 8 years when we were working together at the Professionals Treatment Program, where we treated mostly physicians who were battling addiction issues, and other professionals, lawyers, pilots, I think. And you were giving psychological assessments, and I was one of the primary therapists there. And I always found it so fascinating to sit in when you were giving the patients the results of the assessments. Could you touch on that to tell the audience what an assessment is, a psychological assessment?
Yeah, so a comprehensive neuropsychological assessment really has 3 major components. We assess all of their symptomatology, everything from what they historically presented with to what does it look like sort of at a bird's eye view. Aside from the depression, what else are they suffering from, right? Kind of want to make sure that we're hitting everything that needs to be addressed and treated. And then we look at their personality traits. Some personality traits are very protective, can help the individual in times of stress. Other personality traits, not so much. They might even be risk factors for them to use again or for them to get into a cycle of depression or anxiety. And then finally, cognitive functioning. A lot of times, individuals who might have substance abuse in their past, maybe traumatic brain injuries of other sorts, they will have disturbances to their cognition like attention, memory, visual spatial processing speed, the way they use language. And we need to know that also because if they can't process the therapy, it would be important for us to adjust the sessions. And also, we need to know exactly where they are maybe right now because there are interventions that you could do to improve your cognitive function. And we want to make sure that we give them the best chance at life. And so that's always important also. Sometimes they get really frustrated with their cognitive functioning and they give up on something. So we definitely want to prevent that while they're in treatment.
Yes, make sure that they're able to be motivated to get better.
Absolutely.
Sure. And we both dealt with clients who are in detox and really can't process anything in therapy. So, well, I was always impressed at how you synthesized all this information and put it into a very comprehensive way for the client. And I have to say, that's what you've done with this book.
Oh, thank you.
You brought all this research, from, and science-based, evidence-based research and put it into a how-to book with practical exercises for people to really use. I mean, they can change their lives with this.
Yeah, that's what I'm hoping for. I mean, I think that really everybody self-sabotages. It's a universal phenomenon, and I think that people need an answer. So a lot of times they know that they're self-sabotaging, but what's frustrating is that they don't know the way out. And I was hoping with this book that there would be hands-on exercises that didn't feel too stressful or complicated so that people could apply it to their lives in different domains, whatever they're sabotaging. So it could be work, it could be relationships, it could be health, but whatever the area, I wanted it to be accessible so that people could read it at home and put it to practice immediately.
Right. And now in your practice, is there an area in particular that you see people self-sabotaging in? Because I think, anybody watching this might say, well, I sabotage myself in relationships, but I don't know if I'm the only one, or
yeah,
I get in my way.
Yeah, you know, what is the funniest thing about self-sabotage is that it's never just all areas of your life. I hardly ever see people who just, their entire life's a mess. Actually, most people are pretty successful at many areas, and it's just one or two areas that they just keep tripping up and they don't know why, you know? And
right.
So one of the most common ones is relationships, especially intimate ones. So what I find is that oftentimes people can be very well versed at their work. They can hold things together at their jobs. Their friendships are fine, they're flourishing, their health behaviors are generally in check. But then it's when they start dating or their choice of partners and they just kind of keep staying in that same rut, even though they say they're not happy. This is not the person I want to be with. And then the next person they date, it's the same cycle.
Right.
It's a common one. But I also think that another common area where people self-sabotage is health. So anything like an exercise regime, or when you're trying to start a new healthy eating habit, they'll trip up and, oh, everything's over, and very black and white thinking.
Yes.
Where they just completely forget it. You know, I've already fallen off the wagon, ate half a donut, I should eat 3 more donuts. Forget it. Like the whole day is ruined, right?
The pint of ice cream is the one for me.
Yeah, oh, I know. Gosh, you know, I mean, it's not satisfying to get like a tiny bit out of it. You
No,
just, like,
who
want to eat
wants
it from
that?
the pint.
Go for it.
Exactly.
So, well, you know, and I've seen it in practice, being that I'm a marriage and family therapist. I work with a lot of couples, and both people can be highly successful at what they're doing in their business or professional lives, but they are lost with their relationships. So this can really be applied to different facets of someone's life.
Yeah, absolutely. And just kind of bring that control back. You know, it gets really scary after a while if you see the cycle happening, but you feel powerless to control it. So the whole idea of the book is like, bring the power back, get the knowledge in there, and then get the skills and the tips so that you can change your life.
Yes, I even felt a little bit more empowered, even though I'm you know, based in cognitive behavioral therapy. I was reading, I'm like, I can use this in certain areas of my life, you know. Thanks for watching the show. If you liked what you just saw, please subscribe to the channel so I can bring you more mental health and emotional well-being content. This channel is for you, so I would love to hear your comments. Did you relate to anything you saw? Or what kind of issues would you like me to address with the professionals I interview? Check out the next video, and thanks for watching.